This is Georgina Villasenor, and welcome to my multimedia discussion for week 2. In this presentation, we will cover an example of a market failure and how the government intervened to help the market. One of 4 government activities we see take place in the market is through the redistribution of income and wealth. And we see this through public assistance programs like food stamps, which are more common, or through social programs like the unemployment insurance or Medicare, where citizens have kind of paid a portion maybe throughout their employment and at some point may need to receive those benefits. And so in the 1960s, we saw that the private market was unable to provide insurance for the elderly due to the high costs and risks that were associated with it. And so the incomplete market led the federal government to undertake a health insurance program for the elderly known as Medicare. And we also see it exist today. So Medicare was initially designed after the private insurance system in the 1960s. And at this point, it was really developed to cover huge bills related to hospital visits and doctor's visits. And so what we know today as Medicare Parts A and B, Part A covering hospital and Part B covering medical insurance, or the original Medicare. In 2003, the Medicare Modernization Act was passed, and we now see Part D, which covers prescription drugs. And so as we see how it works today, Medicare is helping to subsidize these costs that private insurances like Kaiser or Blue Cross incur for the elderly over the age 65. In 2016, Medicare covered about 56 million people. Total expenditures in 2016 were about $678.7 billion. And Medicare is largely funded by payroll taxes paid by employees and employers and those who are self-employed as well. So in closing, this goes back to the question of ethics when it comes to the free market. And the government does need to involve itself in the free market at certain times when it's needed, as we see with the development of the Medicare program and when the market is in need, whether it's through a market failure, which would include a recession or maybe a depression. The market will look to the government, and the government is needed to regulate the free market.